First of all, let us congratulate you on being honored the Civilian Award of Padma Shri from Government of India.
Thank you very much. Thanks a lot.
How do you feel, Doctor?
Yeah, I feel very happy and really, in fact, when this announcement came, I was overjoyed. But it sinks in that this also brings in a lot of responsibilities with that. So it is not that you are honored, but there is a responsibility which has come along with that. So I am aware of that, and I'm trying to, get myself prepared for taking up that responsibility.
I'm sure that the Government of India might have taken your social activities along with your medical activities. And how do you plan to go ahead with it?
That's the most important thing. In fact, I think I have been given this recognition because of my social activities rather than business or healthcare activities in which I am involved. So the social activities is very important for a person in healthcare. Healthcare and philanthropy are actually two sides of a single coin. So I am bestowed with a rare chance where whatever I do could be something which is relevant socially, unlike other businesses. So there's a huge requirement for healthcare to be addressed to the people in the bottom of the pyramid. What's now happening, including myself, all of us who build hospitals or other healthcare institutions, it's all commercial organizations which is addressing actually the requirements of the people in the middle class or in the upper income group. So it's very sad, the people in the lower income group, or what we call the bottom of the pyramid, they are really suffering, especially when they have major illnesses. So I think our aim should be to look at those people who require healthcare but don't have the resources to meet that. So that is one of my priorities from that angle.
Now you have extended your wings to India also. Now recently you have started a concern in Vijayawada. And what is your next plan of expansion in India?
See, as I told you, we have now projects coming up in different parts of India. Again, if you look at from the angle, social angle, these are all like good institutions, but will be catering mostly to the people in the upper strata. But I have a project which I am sure is going to help a lot of people in the lower socio-economic strata. We are starting a medical college in Wayanad, which is a place where a lot of low-income population, including about 15 to 20% tribal population are there. There is no healthcare, good healthcare facility there. Accessibility to good healthcare is very poor. So what we have now done is to have this hospital, which is a medical college hospital, built to a level where it can be catering high-level care to the patients in that region at subsidized or free cost. Because medical colleges, basically it is run as a adjunct to a teaching institution where the income comes mainly from the students as fees. So it's possible a medical college hospital can go into a low economy model or a model where it doesn't require too much of money being generated from the treatment. So I'm very happy that I'm doing that. Hospital ultimately is going to be a 1,000-bed hospital. Initially it is going to be 300 beds to be increased to up to 1,000 beds. So that's something which I think will help a lot. Like that, I think we should look at now catering to segments in other parts of India also, not through medical college hospitals, but other methods by which you also look at a high volume but low cost model instead of looking at a very high cost, low volume model.
You were telling about a big project in Cochin, and what is the status now?
Okay, that's actually an iconic project for the whole country. If you look at it in that perspective, it is benchmarked with international institutions. And once it is fully functional, it will be comparable to any world-class institution. And what we wanted to have is in the next 10 years, we want to be ranked within 25 of the world's best institutions. That is our vision for that. So we are investing in the phase 1 about 500 crores. We have taken a 40-acre land. which is a waterfront property, and building a med city there, which has got a hospital, which is the core. And then we have a convention center, medical convention center, which will attract a lot of people from outside for medical conventions, including very high-end consultants and all. And we also have a hotel there, which will be catering to the faculty as well as to the patients, bystanders. And we have the staff accommodation. So altogether, we have a large land, which is as phase 2 will expand into a 1,000-bed hospital. Phase 1 is 500 beds, phase 2 will be 1,000-bed hospital. So this whole thing, it is not that this is a 1,000-bed or 500-bed hospital, but it is going to provide cutting-edge technology. We have 6 centers of excellence where individual specialities will be taken to the highest possible level of equipments as well as expertise by doctors joining that. We have a center of excellence in orthopedics, center of excellence in cardiology, cardiac surgery, then in gastroenterology, GI surgery. We have in pediatrics as a center of excellence where you will have all the subspecialties of pediatrics, which is not there in India at present. And like that, we have selected 6 initially, and that will be expanded further in the phase 2.
So when is the first phase going to be functional?
Yeah, we will be starting the function or we hope to admit the first patient by early 2013. We have just got the permissions from the government. We will be starting the work now, and it will take 2 years for us to complete and admit the first patient. Thank you very much. Thanks a lot. Really appreciate, and my greetings to the Moon TV, the Gulf Band, the people watching that, and all the people from Tamil Nadu.
Thank you very much, Dr. and all the best.
Thank you.